Hi everyone, my name is Brian McSorley and these are the findings of an evaluation conducted in November 2022 in relation to Oxfam's experience piloting 4 solar-powered desalination systems in Somaliland. Very briefly, it's important to understand the context. Groundwater across large swathes of Somalia is saline. Above a conductivity of 1,000, water starts to become progressively unpalatable. So the blue areas on this map indicate fresh water. Green is starting to reach a threshold of acceptability. Yellow might be suitable for some domestic use but not drinking or cooking. And orange and red might not even be suitable for some livestock. So that's the situation within the middle zone of this map, Sul and Sanag regions, where Oxfam has programs in Somaliland. It doesn't mean it's not possible to find fresh water, but it's risky as groundwater is deep and the cost of drilling a borehole may be anything between $100,000 and $200,000. This graphic illustrates how reliance on different water sources changes throughout the year. During and immediately after rains, the main source of domestic water is rainwater runoff, principally captured in underground reservoirs known as berghads. But increasingly erratic rainfall is reducing the reliability and duration that water is available from berghads, and this is driving growth and dependence on water trucking. Some villages, however, do have shallow wells or boreholes where water is saline, and our pilot was to demonstrate that these offered a cheaper, more sustainable solution to providing water for domestic consumption than water trucking, if that water is treated. After crunching a few numbers and conducting a willingness to pay survey, we concluded that water desalination should be more affordable than water trucking, and powering RO systems with solar panels as well as reducing operating costs is a greener solution. But we were acutely aware of the risks. So we all know that it's much more difficult to maintain water infrastructure than to build it in the first place. And if much simpler equipment is ending up like these photographs indicate, what hope is there for a desalination system which contains multiple pumps, pre-treatment filters, requires addition of chemical anti-scalant and needs close monitoring and very systematic processes to follow at the startup and shutdown. I've included this photograph of solar panels because whilst many of us, myself included, consider that solar pumping has been a game changer in terms of reliability, there's quite a lot of evidence questioning their long-term sustainability due to the lack of measures that many systems are putting in place to address future breakdown when ultimately breakdowns do occur. So 4 desalination units, each capable of providing between 5 and 10 cubic meters of water per day, were procured and installed by a European supplier in 4 different villages. All systems have been beset by problems, and despite the best efforts of our team in Somaliland, none were working at the time of the evaluation. So Oxfam had nothing to show for an investment of over €200,000. The longest any of the systems have functioned for was about 4 months. Because performance drop off soon after installation, treatment systems didn't produce as much water as expected. They couldn't meet demand. People got frustrated queuing or being unable to obtain water, and performance fell well short of cost recovery targets. Membranes that should last 3 to 5 years were spoiling in as many months. I don't have time to go into technical detail. I'm happy to discuss offline for anyone interested, but I'd like to pick out several key areas that contributed to problems. Many of the problems faced are no different to challenges affecting any humanitarian project. So short time frame, limited resourcing and staff turnover certainly impacted on planning and limited the external consultation and community engagement. Pilot projects are inherently more resource intensive if you want to do them justice and give them the best chance of success, because so much is new and uncharted territory. The equipment supply was very committed, but there were some technical equipment issues that hindered performance monitoring, and with project sites being 3 to 5 hours drive from Oxfam's field office, monitoring was very challenging. And this was compounded by a lack of technical expertise. For troubleshooting, we were dependent on experts in Kenya and Germany. But without trying to be too simplistic or state the obvious, the key underlying issue of why the systems failed was because of weak management and oversight, failure to strictly adhere to standard operating procedures, failure to closely monitor performance, or be proactive and escalate problems and try and nip things in the bud. The importance of having professionally competent, qualified managers in charge was highlighted as a critical issue at the planning stage, but despite this, the systems are entrusted to village water committees who were simply not fit for the task. If this statement was ever in doubt, it became hard to dispute when we observed that alongside our non-functional desalination systems, there were examples of privately managed RO systems that were working successfully. 2 months after this evaluation, I visited Kenya for a similar piece of work and found the same there. So the photo on the right is the same equipment from the same supplier that we used in Somaliland. So this confirmed that the outcome was not inevitable. The problem was somewhere within our approach, not the technology itself, and that with the right skills and expertise, desalination can be viable in these contexts. We're currently trying to put our learning into practice in Chad, which is at the same point our Somaliland team was back in 2017. The context is very similar: saline groundwater, dependence on water trucking, which will only grow. And our starting assumption is that a desalination system is too complex to reasonably expect a community committee to manage. But there are competent individuals, businesses or social entrepreneurs who we could partner with and that do possess the skills and wherewithal required, as evidenced by the photograph of this bottling company we came across during the feasibility study in Chad. But it's going to take time to identify, negotiate and agree the modalities of working together. It obviously needs buy-in from communities and authorities, and there's currently no existing desalination technical capacity in Chad, so this needs nurturing also. There's a lot within the project logical framework or theory of change that needs testing, but that's why we've designed a 10-month planning phase built into the project, and the Chad team will only move forward if they're confident that there's strong foundations in place for success. As I said, pilot projects by their very nature are resource intensive, as we're trying something unfamiliar and non-conventional. And thinking back to the earlier table, with additional time and resources, most, if not all, of the external issues become more within our control, and some of the constraints are no longer there. To conclude, it's still work in progress, but I wanted to present this today because some of the best learning comes from failure, for want of a better word, but we do often shy away from sharing such examples. The advice I would give any country program is that reverse osmosis desalination should be a solution of last resort. This was the situation in Somaliland, but I've seen elsewhere teams come up with the solution and decide to implement a desalination project because it's different and has a wow factor, and then look for a place to trial it, which is clearly the wrong way around. Start with the need and the problem, and only if there's no other solution, consider desalination. Increasingly though, there will be more places where it will be needed as a climate resilient solution. It's been a huge learning curve for everyone involved in Oxfam, but despite these setbacks, I'm confident that desalination can be an appropriate solution in arid and semi-arid regions that are otherwise reliant on water trucking, but only if the necessary time and resources are invested to make it a success. There's no margin for error in this type of project. Every small issue is magnified and compounds the previous one, which could be an operator failing to add the correct amount of anti-scalant or performing the correct shutdown sequence, and very quickly your water output is reduced by 50%. Our Somali team has developed a plan to bring systems back into operation, which focuses on private sector partnership, which it will take forward over the next 9 months. I can see in my head the roadmap to make it a success along the lines of the Chad example, but this is not easy for many humanitarian operations to plan, resource, and then follow through on. Hopefully I'll get an opportunity to update on progress at a future Environmental Health Forum, and thanks for listening.